I had an appointment this morning and I was waiting for the provider to come in and I could hear her outside and all she goes is, so it begins. And it's just, you know, it's one of those things. We've all been there.
Yeah, and I was going to say that. I mean, we were talking actually earlier this week and then today. It is so hard some days to like get going because it's a performance. It's a real performance though. I mean, it's real. It's all genuine. But it is
you have to like give you're giving yourself, right? You're communicating with patients. You have to give them your energy to help them feel better because you need to feel what they're feeling and like make those connections. And it makes you can tell when people aren't making those connections because it goes disingenuous.
Yeah.
Did that make sense?
Disingenuous.
Disingenuous.
But is disingenuine also a word? Are they both a word that can be used interchangeably?
Yeah, I don't know. But moral of the story when we're coming in is...
It's been a while since we've done one of these.
I know, I was sitting there, I was like, oh man.
We used to do these more often.
It makes a difference.
It does.
How, especially as a provider, it makes a difference for how you show up, how you communicate, and your energy that you bring in. You never know who's watching and who's listening. So just as like a provider speaking to another provider and like...
I think even to patients.
Yeah.
I mean, I feel like it's also important to know like this side of things for us too, because like this is the thing we have to work on so consistently is the way that we show up for you guys.
Yeah. Put everything else aside.
Yeah.
And your face isn't in it, Jessie. There we go. You know, for us, we have to put a lot of just things to the side and like table it for the day because my focus has to be on you in order for you to get the care that I want to give you. And I love every minute of that, but then you can definitely feel when people maybe aren't quite separating those two things, you can just tell that like the energy isn't all the way there. And then I feel like patients kind of get the butt end of that.
And I think this applies to life.
Yep.
In general, the way you show up for everybody. But yes, in a profession like this, it is especially important, patient care. So we're gonna leave you on that note this Friday, and we're gonna go look up whether disingenuous and disingenuine are, in fact,
both
interchangeable words or words in general.
Yeah.
Okay. Have a great week.